Oops, sorry about that. Good morning, good evening, and good afternoon, everyone. Thank you for joining us for today's webinar, How Can Innovations Advance the Nutrition Data Revolution? A discussion of practical examples from innovation users and implementers. My name is Lexi Farina, and I'm a program associate at Results for Development. We're excited to have you all here today. Next slide. A few housekeeping notes before we get started. Microphones are muted during the presentation. Please use the chat box at the bottom of your screen to connect with other participants or to contact our team for logistical support. Please also share questions for our speakers using the Q&A feature, and if possible, indicate which speaker you are directing your question towards. We will answer as many questions as possible during the Q&A session, and copies of the presentation will be shared in the coming week on the community event page. A recording of the webinar will be immediately available on the Data for Nutrition YouTube channel. Next slide. If you're experiencing any technical difficulties, you can contact our team for logistical support by using the chat feature and selecting all panelists at the bottom of the screen. We will do our best to respond during the webinar. Next slide. Today's webinar will be hosted by the Data for Nutrition Community of Practice and the Agriculture, Nutrition, and Health Academy. Data for Nutrition is a community which provides members with opportunities to share knowledge, experience, and questions relevant to strengthening the nutrition data value chain for the purpose of achieving better nutritional outcomes in low and middle income countries. We are proud to say we have 923 members and are still growing. The ANH Academy is a global community of interdisciplinary researchers, practitioners, and policymakers working on agriculture and food systems for improved nutrition and health, with over 6,000 members from 145 countries. You can use the link on the screen to join the community. We also invite you to save the date for the 7th Annual Agriculture, Nutrition, and Health Academy Week, which takes place over 2 weeks from the 20th of June to the 1st of July. Next slide. For today's webinar, Mr. Mushiri Nyago will serve as the moderator. He has more than 20 years of experience working on software development and technology innovation for those living on irregular income in Africa. He currently serves as the Executive Director of the Local Development Research Institute in Kenya, and previously served as the Deputy Executive Director and Policy Lead at the Open Institute, where he worked on open data projects at the national and subnational level. Next slide. In today's webinar, you will hear from our 4 esteemed panelists, Mr. Ricardo Lampariello, Ms. Melissa Perspad, Mr. Felix Brooks-Church, and Dr. Talia Sparling. Ricardo is the head of the health division at Terre de Hommes, the Swiss leading child protection agency, improving millions of children's lives worldwide, where he drives the development and deployment of innovative projects, including one of the largest digital health solutions in sub-Saharan Africa. He has over 20 years of experience in health, from pharma to international organizations and NGOs. Today, he will share with us the integrated diagnostic approach, a digital solution to strengthen primary healthcare, and how this has been scaled up in Burkina Faso. Melissa is the Director of Growth at Fraym and leads the Global Development Portfolio. In this role, she works with partners to leverage geospatial data to design, layer, monitor, and evaluate programs globally. In addition, she has years of experience in mobile messaging and data collection across sectors. Today, Melissa will share more with us on how Fraym can be used, including to understand where communities are experiencing acute malnutrition. Felix Brooks-Church is the co-founder and leader of Sanku, a fast-growing social enterprise working to combat hidden hunger and save lives by giving small mills the tools they need to fortify maize flour. Felix has spent more than a decade developing and refining solutions for small-scale fortification and led all aspects of product development and engineering of Sanku's award-winning fortification technology. Today, he will share more on this technology, including the digitization of the fortification process. Talia is a research fellow with the Amana program and the nutrition group of the London School of Hygiene and Tropical Medicine, where she primarily works on evidence synthesis of tools, metrics, and methods used to study agriculture to nutrition pathways, as well as the linkages between mental health and food and nutrition security. She will share more today on innovation trends and gaps in agriculture, nutrition, and health research. Next slide. Today's webinar highlights work conducted under the Data for Decisions to Expand Nutrition Transformation Initiative. DataDENT aims to transform the availability and use of nutrition data by addressing gaps in nutrition measurement and advocating for stronger nutrition data systems. Ahead of today's discussion with our panelists, Dr. Yashodarana will share findings on DataDENT's landscape of nutrition data innovations. Yasho is an associate director at Results for Development, where she oversees the nutrition team's data learning and practice, including the DataDENT R4D work. I will now hand it over to Yasho to share what we have learned about nutrition data innovations. Yasho, over to you.
Next slide. Thank you so much, Lexi. Good morning, good afternoon, and good evening, everyone. In 2014, the first Global Nutrition Report proposed that tackling malnutrition required a data revolution. Nearly 8 years later, the revolution is still being realized. Data innovations may hold the promise for addressing nutrition data gaps. So to start us off, I wanted to share a few examples that we found exciting while conducting this review. The first is the World Food Programme's Hunger Map Live, which provides near real-time monitoring of food security in more than 90 countries, and it is hosted online for anyone to use. What is interesting about the system is that it not only brings together information from many different sources in an easy-to-read format, but also uses artificial intelligence to make informed predictions on food security, even in areas where data is missing. Another one to highlight is the Child Growth Monitor, which is a mobile app where the community health worker takes a picture of a child and then the app will automatically diagnose malnutrition through the photo using machine learning and intelligent algorithms. This proved to be especially useful during the pandemic as social distancing has stopped measurement activities in several countries. As we all know, the COVID-19 pandemic amplified the need for high quality and real-time data in all aspects of nutrition. Therefore, we find this work is timely, given that there is a lot of momentum around leveraging new data sources, methods, and technology. And so we figured we would use this opportunity to not just echo the need for better data in nutrition, but also explore potential ways to fill this gap. Next slide. With this preamble, this work aims to conduct a landscape of trends and opportunities for nutrition data innovations. The objective, to start a conversation around emerging solutions and potential investments. Given the limited work in this space, we had to limit the scope to make this feasible. So we included data innovations created in or after 2015 within the nutrition domains of nutrition status, diet, food environment, food security, food fortification, and micronutrients. It is important to note that we did not include the expansion of existing nutrition data sources, methods, and partnerships to new contexts or innovations pertaining to nutrition-sensitive data. We identified these innovations through a combination of desk reviews, primarily looking at gray literature and stakeholder consultations. Next slide. As a starting point, we spent a lot of time first developing this framework you see to guide our work, since we could not find any previous work which really organized this space. We did so by conducting a rapid review of the data innovation space more broadly, and then sense-checking these categories with a few experts. We identified 9 data innovation categories, which I will briefly mention, going top to bottom and then bottom to top. So starting off with indicator development, which most of you are aware of. Next, digitalization, which uses digital technology to move paper records to online systems. Citizen-generated and open data, which includes data sourced directly from individuals, data that can be freely used, shared, and aggregated together for public value. Geospatial data and statistics, mobile solutions, artificial intelligence, which uses computer systems to perform tasks normally requiring human intelligence, such as visual perception, speech recognition. This category includes subcategories such as machine learning and deep learning, terms that you might have heard frequently being mentioned nowadays. Modeling and simulation tools, data visuals, data collaboratives, and partnerships. A frequent question we often receive is, what about big data? In our framework, we have not called out big data as a separate category because big data may be derived from mobile solutions, geospatial data, health reports, and it could be often processed using artificial intelligence or visualized by data visuals. So it could touch upon several of our categories in our framework. Next slide. Depending on how these categories, these trends are used, data innovation categories have the potential to influence one or more segments of the data value chain. What we mean by the data value chain is what you see in the columns, starting from what needs to be collected, ending to its actual use. And then you have the trends in the row. Let's take just one category as an example. Modeling and simulation tools primarily take data from other sources and help with analysis to make predictions or guide decision making. And so they really impact the analysis aspect of the data value chain. And here, I will pause here for a few seconds for you to review the other categories. Next slide. And so now that we have this background, let's dive into the findings. Next slide, please. There's a growing number of nutrition data innovations, and we found approximately 60 in the domains and sources we reviewed. As you will see in the left-hand side of the slide, majority of them are around nutrition status, specifically around anthropometry and growth monitoring, followed by diet indicators and fewer around micronutrients and food fortification. Across these domains, it's also important to note that majority of them are in that middle half of that chain, so around collection, curation, and analysis, and fewer around the ends, around prioritization and use for decision making. Lastly, majority of nutrition data innovations are mostly in the development and testing phase, meaning that a prototype is either being developed or tested in the field. Next slide. A significant number of nutrition data innovations found are around mobile solutions, artificial intelligence, or digitalization. Let's start with mobile solutions. Mobile solutions can be used to collect and store data in real time, like Citizen H2D3 system, which crowdsources data on dietary diversity using a mobile app where citizens voluntarily input food consumption data. It can also be used to improve the accuracy of diagnosing nutritional conditions. And an example that I provided earlier was around that photo diagnosis app. Mobile solutions can also enable remote data collection. And you'll be hearing more about the Sanku dosifier innovation from our panelist, Felix. And this innovation was also named as one of the best innovations in 2019 by Time magazine. Equally important to mention here is that throughout the COVID-19 pandemic, stakeholders most commonly used mobile solutions to address data challenges, primarily around nutrition status, diet, and food security data. Next slide. This slide highlights the use of AI and digitalization, the other two categories that we found in our review. AI is used to analyze large amounts of data and provide predictive insights and forecast food insecurity and malnutrition. As shown in this nutrition early warning system, which uses machine learning to aggregate and analyze satellite imagery and traditional data to provide ongoing surveillance of nutrition threats. It also provides decision makers options for nutrition interventions they can use depending on which scenario is predicted. According to the most updated information we could find online, This system is currently being piloted in 9 countries across Africa. Digitalization. An example of this is WFP's CODA, which replaces pen and paper reports with a digital system. It gives a digital identity to patients and then is able to track their nutrition services using mobile phones. All of this data is then linked to an electronic database for easy access later on. Another example of digitalization of health and nutrition reports, you'll be hearing from our panelist, Ricardo, on his experience scaling this in Burkina Faso. As you think of these categories, it is important to note that even with all of these benefits, there are risks and feasibility concerns to keep in mind. For instance, AI is not always feasible, given its implementation requires specialized technical knowledge and equipment. And with digitalization, there can be risk around data privacy, security, and the potential of a system failure. Next slide. Nutrition data innovations have started to bring solutions to fundamental data challenges, but there's still a lot more work to be done. Let's take micronutrient data as an example. Within this domain, there are challenges related to a lack of new data. Innovations such as modeling and simulation tools are being used to provide estimates of micronutrient deficiencies where the primary data is not available. An example here is the Micronutrient Action Policy Support, the MAPS tool, which is in the development phase and is meant to communicate estimates of dietary micronutrient supplies and deficiencies risk across African countries. The map that you see on the screen shows a comparison of the dietary iodine supply in Malawi with and without iodization of salt. However, even with innovations like this, we've heard challenges remain given country decision makers would still like to have primary data, therefore requiring fast and low-cost diagnostic tools and standardized protocols to collect this data. Next slide. Finally, there is potential to further leverage data innovations and existing solutions from other sectors to strengthen the nutrition data value chain. 4 areas we feel nutrition can learn from and further leverage include geospatial data, citizen-generated data, artificial intelligence, and data collaboratives and partnerships. For the sake of time, I will highlight 2 of these. Let's start with geospatial data. Geospatial data has been especially useful throughout the COVID-19 pandemic, as maps can aid better visualization, understanding, and response planning for decision makers. So in the example that you see in this slide, ESRI, a global company focused on geographic information systems, GIS, worked in collaboration with Johns Hopkins University to develop a dashboard which provides near real-time data on the COVID-19 pandemic. This online dashboard quickly became the de facto global source for COVID-19 data. And the best part is it can be accessed and understood by anyone. Just to plug here, you will hear more generally about the use of geospatial data for nutrition data gaps from our panelist, Melissa from Fraym. I also wanted to highlight data collaboratives and partnerships, since innovation is not always about developing a product or technology. Collaboratives and partnerships leverage the expertise and collective knowledge of several key experts. They can also include data sharing and promote openness across public, private, and academic institutions. An example we're highlighting here is the partnership between Nepal's largest mobile provider, who shared phone data with a nonprofit called Flowminder to map the movement of people caused by the 2015 earthquake to assist with targeting aid to those most in need. Within nutrition, there may be opportunities to form new partnerships or leverage existing ones in the broader data innovation space, such as with movements around open data or innovations to meet the Sustainable Development Goals more broadly. Next slide. Given these unused opportunities, we recommend all stakeholders, next slide, to take a strategic approach to innovation investments, including, for innovation adopters, we recommend mapping data gaps first, and then matching these to potential innovations while leveraging a mix of both old and new methods and technologies. For funders, we recommend taking a more strategic approach to investments, really focused on considering the entire pathway of scale and sustainable funding, including co-funding with other potential donors. And finally, for all stakeholders, we highly suggest considering feasibility of innovations, including around costs and capacities, risks such as data privacy, quality, and equity. And you'll be hearing more on this from our fourth panelist, Thalia, from the London School of Tropical Medicine and Hygiene. With this, I'll hand it over to Ashari, our moderator for this webinar, to take you on the journey of these innovations with the note that I'd be happy to answer your questions in the Q&A section. Thanks, everyone. Over to you, Ashari. Ashari? Sounds good. I think Ashari, who's our moderator, got disconnected. He's been joining from Kenya, so I'll just step in the meantime. So Ashari, are you back? Okay. So we have our first panelist, Ricardo. And Ricardo, to start us off, given this background, we'd really love to hear from you about your work in Burkina Faso and how that experience has been. So over to you, Ricardo.
Thanks a lot, Yasho, and thanks for the invitation. There are infinite ways to innovate, but there are also a lot of failures around innovation, around digital initiatives. And today I would like to share with you the experience of Terre des Hommes in Burkina Faso, which we were able to scale at an unprecedented level, AIDA, the integrated diagnostic approach. Next slide, please. So IEDA, as you can see, can be summarized as a sort of application installed on a tablet to help the healthcare workers to make a better job. Over the past 12 years, the Ministry of Health of Burkina Faso and then the international NGO Terre des Hommes have partnered together to design and deploy a digital strategy to support the healthcare workers, but in general, the primary healthcare of the country. So healthcare workers use a tablet, as you can see in the picture, during their child consultation or a pregnant woman consultation, and the tablet helps them to follow each steps of the national clinical protocol to improve the diagnosis for sick children or for pregnant women. Upon introducing all signs and symptoms, then the app will provide a result. But let me give you some concrete screenshots of the tool. Please, next slide. So these are three different screenshots. The healthcare worker enters his or her credentials, and that has several options. For example, now wants to look for a child that has been already consulted in the past. He looks for the child, and then on the right side, you have the summary of the child's consultations in the past. Next slide. The healthcare worker goes through the clinical consultations. The algorithm provides the questions according to also what the child caregivers answers are, and helps to navigate a complex clinical protocols. We also include malnutrition aspects. So it looks for malnutrition in the child. It looks for many other pathologies and conditions. And at the end of the day, on the right side, it provides a diagnosis together with the treatment. Of course, this is a suggestion, and we leave up to the healthcare workers to decide. But this is based on, again, on a validated national clinical protocol. Next slide, please. At the same time, we take advantage of clinical consultations also to provide advice to the caregivers or pregnant women. So, for example, in the context of COVID, we also provided reminders about hygiene practice, or in the middle, this is for a newborn child, a little child, a reminder to the child caregivers, to the mothers or to the fathers about how to nurture the child. And then on the right side, this picture actually comes from India, and this is more about counseling a pregnant woman. Next slide, please. So, but this, I said, is an app, but it's not an app. It's an approach, and it fulfills multiple aspects. And one of that is actually the collection of data out of these consultations, and then the ability to actually use this wealth of data to do some more sophisticated activities. And one of that is the use of artificial intelligence to provide a more reliable diagnosis. A more reliable diagnosis actually obtained by entering more reliable data. We know that there are mistakes when data is entered. So if you enter mistakes, then the results will also be, there will be errors in the results, in the diagnosis. So by the use of artificial intelligence, we actually aim to able to spot if it is a potential mistakes. And so by using complicated algorithms, which actually are hidden for the healthcare workers, the outcome is actually a warning to the healthcare workers, reminding him or her about, are you sure that you entered the right data for the child's weight or the child's height or other parameters? So for the time being, this is a reminder, and actually we spot a lot of mistakes so far, and this is one of the uses. Next slide, please. But also, it also fulfills some management performance of the healthcare worker and the healthcare facilities. So the information goes back to the healthcare worker and actually provides a sort of dashboards about their consultations with some warning signs in case the performance or the pathologies they have identified, the number of them sounds a little bit suspicious. Next slide, please. The information is also collected at central levels. This is a map of Burkina Faso. There are almost 2,000 healthcare facilities that are equipped with such a tool, which represents 85% of the total country. Last year alone, there were 5.5 million consultations uploaded. And so you can see that with just a graph like that, national authorities can monitor anything that is collected, from data on nutrition, actually malnutrition, to potential outbreaks of diseases. And actually it was used also during the pandemic to monitor COVID. Next slide, please. And this is my last slide is about another way to use artificial intelligence. I think it was mentioned by Yashodarana. It's about predicting crisis. It could be in this case, in this specific case, is about malaria, so potential malaria in the country, but could be used, and we will try to use it also for malnutrition. And this is to give you a short demo of the tool. Thanks.
Oh, thank you, Ricardo. This is Mushiri, the disembodied voice of your moderator. I just a quick question, because this is a fascinating piece. The scale is amazing. But are you able to tell us a little bit about what kind of challenges did you face? Are there key enablers that made it possible to do such an innovation at countrywide scale?
Thanks. I think it's important to think about the challenges, the barriers, and also the enablers. I think for me there are two very important aspects that we should really focus when we try to scale digital initiative. The first one is knowing the context. And when I say knowing the context, I refer to multiple things, starting from the needs. Of course, you need to know what are exactly the needs, but also you need to know other things like the politics of the countries. There are so many stakeholders involved, who can actually push back your digital initiative, because it's a change, so there is a resistance to change, and but they could also help to propel the initiative. They can support the initiatives. So knowing the context is actually fundamental, and actually you realize there are so many stakeholders involved that many more that you initially had thought of. And so I think this is fundamental, and that's why I think we keep saying that it's not just an app, but it's an approach which is need to take into account all these stakeholders and how to navigate the politics, the dynamics when you initiate a digital health initiative. The second one is I think it's about we talk a lot about the data, and we think about the data collection, but data collection alone is not enough. I think really if you want to develop a data collection tool, you have to think about an integrated approach. You need to think about not only digital integration in terms of interoperability, in terms of providing other options, but you need to think about the integrations in the operations. And including malnutrition or nutrition, this has to be integrated in a broader spectrum. So I think this is fundamental. At the same time, I think it's also an opportunity for digital health to bring a systematic change in the operation. So it's basically the digital opportunities that actually push for an operational change. This is obviously much more ambitious, but this is where I think there are the opportunity for digital transformation. And we have launched that in the case of Alidia, the Alliance for E-Diagnostic, where three big NGOs, World Vision, Action Against Hunger, Terre and Hommes, have joined forces to bring a systemic change through digital health.
Thank you, Ricardo. This has been fascinating, and we'll continue to follow your work. Just one question from the audience in 30 seconds. Someone's asking, is there a plan to use this app in East Africa? And it's not me, just because I'm based in Nairobi. And I think they're asking for all of us.
I think there are a lot of discussions about to make YEDA, but not only YEDA, a public common good. At the moment, YEDA is deployed in Niger, in Mali, in Guinea, and in India. But definitely, we could support development elsewhere. And this is also why we decided to join forces with other big NGOs to be able to replicate in areas where Terre des Hommes doesn't have a footprint.
Thank you very much, Ricardo. I know there's a few other questions that are coming, and we shall be sharing them shortly. Colleagues, please do remember to put any questions you have in the Q&A. And if you can see the chat function, please do go ahead and use that to share any comments, any perspectives you might have, or links to resources. Let me ask Melissa now. You're doing some really fascinating work at Fraym with data science and earth observation and whatnot, all these interesting technologies, but you're doing them in some of it in the nutrition space. Could you tell us a little bit about what you're doing at Fraym?
Absolutely, thank you so much. So at Fraym, we really aim to map humanity. So we are using machine learning and integrating it and applying it to understanding the challenges of mapping data subnationally to be able to have very local information in decision-making frameworks from grassroots to grass tops. At the end of the day, what we're producing is hyperlocal data that our partners are then able to use to zoom into a neighborhood and see population characteristics, demographics, socioeconomic data, and understand attitudes and perceptions, which all woven together provide a holistic picture of what is going on in a community before boots arrive on the ground, to identify potential vulnerabilities and to plan accordingly, and to then better understand the resource allocation needs, and finally think about measuring the impact of programming as we see some of these characteristics change over time. Next slide, please. As I mentioned, we are using machine learning, which is in the artificial intelligence category that Yasho walked through earlier. And what we're using are core data sets that are publicly or semi-publicly available. I think this is particularly important in the context of today's discussion because we are using, in many cases, government-approved, government-validated data sets like the DHS or LSMS as our training data for our neighborhood level predictions. And increasingly, we are fielding our own primary data collection to fill data gaps and using the same methods to then produce the hyperlocal data that we're going to look at today. That means that we have both the kind of validation in terms of a comparison to national metrics, nationally accepted metrics, but then also can integrate that data into decision making quite quickly. Next slide, please. So I wanted to talk a little bit about what the data is and go through a few screenshots and visuals to articulate what we are working with here. So our partners are looking at an indicator of interest. In this case, we're looking at child stunting in Nigeria. And this is already localized to the LGA within Nigeria, and you can start to see the hotspots of where there are issues of stunting across the spectrum from 0 to 100%. We can move to the next slide. With our software and our technology, we're now able to get down to 1 square kilometer. So now you can see the LGA data is actually spatially distributed quite differently, where we see high concentrations across borders that were masked by the LGA statistic, let alone a national or a state level statistic in Nigeria. And you can think of any indicator about population characteristics or household composition, decision-making power, dietary diversity, disaggregated and visualized at this square kilometer level for the same level of understanding. So we can weave together something like a child stunting indicator here with a set of population characteristics that allow us to understand the drivers, barriers, and opportunities for each community for really targeted, specific interventions based on the location and of the issue. Next slide, please. So here we're zooming in. As I mentioned, we can look at a whole series of nutrition data, for example, also looking at what food is being produced in the community, how near or far those communities and those, in this case, 4,000 people in these, 6 square kilometers, 6 pixels here, or 8 pixels, excuse me, how far they live from a road, what crops are being produced in their households and in their communities, other complementary nutrition data sets to the stunting measure. That is our primary indicator here. And then also look at the relationship between these communities and the rest of the LGA for decision-making constituency, to think about government involvement, and then up to the state level, and then up to the national level. And these comparisons are particularly important on the advocacy side when we think about the questions of resource allocation, of driving policy change on nutrition-related policies and interventions, and visualizing the relationship between existing infrastructure across government and across private sector in relation to the issue of interest. So the last point I'll show here is that we have layered on top of the stunting data set and the other indicators on the right panel, the location of a health post, and to start to think about the relationship between where your target population is and a potential intervention site like a health post. Next slide, please. So for our purposes today, I wanted to give a brief overview of what machine learning can bring to the nutrition data set, and start to bring that information quickly into decision making and use across programs. At Fraym, we have now worked in over 70 countries, and today's data set for Nigeria was illustrative of some of the work we've done in the past. If you have more questions, obviously I'm here today to answer them, but you can also reach out to us via email for follow-on discussions.
Thank you so much, Melissa. I'm a big fan of Fraym, so I'm having a moment here. When we grow up, where I come from, we want to be Fraym. But I see a question from the audience. Someone's asking, like other world countries, Ethiopia is also having a malnutrition problem, and we need to conduct a study on this. However, to use some applications like Tableau and SPSS is difficult. They're expensive. We need support in this regard. And I'm wondering, this question about capacity and the challenges in terms of the local human resource infrastructure, finance in terms of access to some of these technologies. What was your experience putting this in play, your tools in play in a context such as this, in a country like Ethiopia? I don't know if it's one of the 70 you worked in, but was this a real problem? Was it an enabler? Was it a challenge? Did you face it?
It's a great question, and we've been working across sectors, and especially working very closely with fast-moving environments when it comes to responding to COVID-19 in the early pandemic days, and still in resource mobilization when it comes to vaccine allocation and distribution. So there's a couple of ways that we have worked with our partners to bring this data to use quite quickly. Our core value proposition is the data itself and the insights you can extract from them. And in some cases, our partners are looking for a deep dive analytical report that just goes into the research question at hand, starts to unpack some of the needs, and then provide some either key findings or recommendations depending on what the use case is. The visuals that we were looking at today are from a light touch web-based application that we created to deliver this type of data for folks to be able to quickly extract insights from and have to do fewer kind of GIS specific manipulations, understanding functions and code that are required for some other GIS software, and especially for integrating data sets, because all of that's done on our side. That platform that we were looking at is called Fraym, and it was actually developed for some of our solar home system company partners who are using this to identify their route to market. And so there's a subscription-based model that once we are able to design the data and produce it, are able to upload to a dashboard and make it really highly usable and actionable at a cost-effective rate. So I think that there's an accessibility question that we are happy to address. And we also, we work with partners across the whole spectrum of need. And our mantra at the end of the day is trying to democratize the data that we produce so that everyone has it for their own specific use case. And then the last is, the only other thing I will add is when it comes to working with government, we do produce data that can be integrated into other platforms. So while we have data frame, we are platform agnostic and have worked with products like, an Esri platform or a DHIS2 to integrate into government decision-making, which has often been a barrier to use from an institutional perspective.
Thank you, Melissa. This has we're looking forward to engaging a little bit more. I know there's some questions from the audience, some follow-up questions that are coming in. But because of time, I'd like to move to Felix. Felix is a Sanku. You're doing interesting work with the dosifiers and this, fortification technology. It's fascinating work. Can you tell us a little bit about what you're doing? And then we can talk about, what you've observed and you're implementing, your solution. Felix.
Great, thank you. Can you see my screen and hear me okay?
Yes, we can.
Okay, great. Well, thank you everyone for this opportunity to speak today. As you heard in the intro, organization Sanku, we work specifically with small mills, enabling them to fortify nutrients into the flour source that everyone eats. And just so for some context, we work in East Africa, and the majority of populations in East Africa don't consume food from large industrial sources, or nor do they purchase from large supermarkets. They buy locally, they mill locally. This is an example of a small flour mill in a village in Tanzania, but there's tens of thousands of these small mills, and collectively they feed nations. So for us, it was an aha moment that if we could build a machine that attaches to small mills, we're going to be able to reach a lot of people. So just so you understand how these small mills work, again, these existing businesses, not ours, the miller adds raw grain into that mill, that green machine. It's called a hammer mill. It gets ground up into flour, spits out into a bucket, eventually into a bag, and it's sold to people on the streets or small shops. But that is how people get their food. So again, we thought, well, let's build a machine that automates the addition of key nutrients like iron, folic acid, B12, zinc, those real building blocks that we need. If we can do that at this source, these mills feed hundreds, if not thousands of people locally. We're going to have a great health impact. We're going to reduce malnutrition rates. And so that's just what we did a little bit over 10 years ago. We built this machine that attaches, again, on green existing mill. It's called a dosifier because it actually doses nutrients to the flour source at that small mill. And the way it works is pretty simple. There's two compartments. One side, the miller, again, adds his raw grain. That's a weight scale that weighs it out. The other side has the powdered nutrients in very condensed form. The two are partitioned correctly as per the addition rate, flowing into the mill, and then we're using the actual mill as a blender to grind up the grain, again, now mixing with the nutrients, and out comes accurate fortified flour for the community. But the big upgrade a few years ago was, okay, let's get these machines, these dosifiers, essentially online. They all have small SIM cards, and they all speak to the local cell towers and send in real time key production data, technical reports, everything that we need to know that these are working and working accurately, flowing to our dashboards. Currently, we use Power BI, but eventually we will develop our own app. This is just one of the many we run a technical report. We can see if the machine is overheating or if there's a feed screw jam. We know if the machine is accurately or broken, accurately functioning or broken before the miller even knows, so that we can send out knowing which regions that dosifier is because of GPS and what issue it might have. We can automate and tell our field staff to go out and visit that mill, fix that machine, guarantee it's always working. And again, now that we know where all the mills are, and we know how much flour they're producing in real time, we can even create kind of heat maps showing production and using that as a proxy for consumption as well, because we know these mills are producing locally, selling, and thus being consumed locally that fortified flour. So we're using Power BI right now. We are also looking at a more customized app, not only for our field staff, but also for millers. So they can automatically, with the push of a button, order more nutrients and empty flour bags, which is part of our business model, and do that in real time, linked to, say, their M-Pesa account, so that we minimize any gaps of product going out not being fortified. So this is a picture now of a mill that's been working again in Tanzania. And it really is the picture of success, what we hope to scale out throughout East Africa. So these pink empty flour bags means it's fortified. That miller now has the tools to fortify, and most importantly, mothers, the main customers, have access to purchase fortified flour, bring it back home, feed their children. We are working with close to 700 mills right now across East Africa, reaching over 3 million people. But eventually, our goal is to reach 100 million people by the year 2030. And great. And you can learn more at sanku.com. Currently, we're in Tanzania. We've just launched in Kenya. But again, in 10 years, we'll likely be in 5 to 10 countries across East Africa. So I'll pause there for a question.
As the biggest enabler?
Sorry, you're breaking up. I couldn't hear that question.
Felix, can you hear me?
Yeah, I can hear you now. Yes.
All right. Now, I was asking, you're already clearly, Sanku is already scaling. Key enable.
I think there's an internet connection on your side. Maybe if you type the question in the chat, I can answer that way.
Also happy, sorry, this is Yasha. I'm happy to jump in, Felix. I think what Mashari, because I could hear Mashari a little bit, Mashari was asking about, given that you are scaling in Tanzania, reflecting on the experience you've had there, what have been some of your key challenges and what has really worked, and what are things that you're still working on? Because the scaling story is so integral for these things to really have an impact. So we'd love to hear a bit more on that.
Yeah, well, getting our DOS fires quote unquote smart with IoT technology and giving us real-time data was that decision was to solve a problem. Prior to that, we had a few hundred machines spread out across Tanzania, a big country, bigger than France. And our field staff with their vehicles would be driving around, visiting mills quite blindly to see if the machine on the mill was working, if it was accurate, if it needed calibration. And obviously, that was going to be a real hard model to scale. It would be quite costly. It wouldn't be accurate in real time. And so the solution was to get these bus fires online in real time. It also builds out the capacity of our staff. Prior to this, they could maybe monitor, 20, 30 mills. We're predicting that each of our field staff can now have a portfolio of, say, 100 mills. That means a lot less cost. That means we can scale faster. We're market-based too. Eventually, we want to be free of philanthropy and really driven by these millers and the products that we sell them. So we want to have a really thin, efficient, cost-effective org chart and operational model. Thank you.
Today has been temperamental, to put it mildly. We have a question from the audience for you. Where does Sanku get your fortificant, and where do you get your information? I mean, how do you decide the levels? Is it an arbitrary Sanku leveling, or is it based on something else?
I'll start with the last part. We add what legally we're supposed to add, meaning the government might get a recommendation from the WHO based on some baseline studies. Anyways, that premix of the nutrients has been formulated to meet a minimum level at daily allowance. So we add what we're legally told to add, and where we source it from any premix provider that is on the Global Alliance for Improved Nutrition's approved vendor list. So they've been vetted, audited to make sure that they're quality companies producing these nutrients. And so either from Germany or India, Turkey, South Africa, that's where we source from. But as we scale in countries like Tanzania and Kenya, we are looking at the feasibility of us owning more of that supply chain, actually blending our own nutrients locally, especially to address any potential supply chain issues, especially during this time of COVID. We want to have a lot of control of getting essentially stuff from point A to point B reliably and on time. Thank you.
Yeah, so just one more question, because I think you said supply chain and just connected. You have this equipment and fortificant, but who's paying for all of this? Is it the miller? Is it the government? Who's paying for the cost of the machine and the support and that fortification at the village level?
Yeah, we have what we call three financial milestones. So the cost for the miller to do the job, to have essentially these nutrients in his flour or her flour, that's been neutralized at that mill location. So that's been sustained. He's able to buy nutrients and empty flour bags. We see a margin from those sales enough to cover all of his inputs. The kind of first financial milestone that we've achieved. We do rely on philanthropy for about 75% of our operating costs, which includes the CapEx, that one-time cost for the machine. But these machines are quite cheap. For less than $2,000, we can install one of these machines. And again, they're feeding thousands of people every single day at that mill, and that machine will last 7, maybe even 10 years. So as far as a return on your investment, especially a health impact return, it's extremely cost effective.
Well, thank you for sharing that. And, a very interesting machine, that implementation, allowing you to collect all that data on a real time across geographies, it really does give new ideas on what could be possible. Thank you, Felix.
Thank you.
Tanya, you've been doing some interesting research on the agricultural side. These guys are growing all this grain and it's ending up in Felix's meals. Felix's intelligent meals, but on that production side, on that agriculture side, with this work you're doing around agriculture and malnutrition, what can you tell us about what you're finding, the approaches you're using?
Sorry, can we get? Oh, there we go. Thanks, Jonathan. Yes, thank you very much for having me today, and very interesting to hear all of the panelists present what they're working on. And I'll be stepping back a little bit as a researcher and somebody who has taken, as I'm part of the wonderful ANH Academy for many years now. And as part of our project a few years ago, we undertook a systematic mapping of innovation of research tools, metrics, and methods used along the pathway between agriculture, nutrition, and health. And we covered the last 10 years. So I'm just going to present, next slide, please. I'm going to present a few findings, and this isn't to inundate you with this tool. I won't be giving you a live tour of the tool itself, but you are welcome to explore it. It's on our website, and it will be distributed along with materials from this webinar. But just to explain a little bit about where our conclusions or ideas come from, this is there's an analysis paper, and there's also an interactive HTML file that includes just over 900 reports that come from both published, peer-reviewed, and gray literature in the last 10 years on that describe innovation on research in this space. And so on the rows, you'll see the different thematic domains along the way between agriculture and nutrition. And then on the columns, you see different categories of tools, metrics, and methods. So there's a big section on technology, and then other types of tools, and then metrics and methods. And the key feature is that this map is interactive in the sense that you can filter it by different characteristics that have been coded within these reports. Next slide, please. So this is a very simplified and flattened version of this mapping, where you can see the concentration of reports at different intersections of the different themes and types of tools, metrics, and methods. And we do see a difference in proliferation of this type of innovations. So there we see a lot of new modeling methods and analysis types, as well as new metrics, particularly in diets, and then a few sort of hotspots of innovation around gene sequencing and food production, or diets, nutrition, and health with the web applications or tablets. Things like that. And this is complementary to what Yasho presented. We took a little bit of a different approach, and some of the categories overlap and some of them don't. But we can see quite a lot of lack of proliferation as well on things like research design and qualitative research methods, things like that. And one note is that because we focused on innovation and we only looked for the last 10 years, we didn't include standard approaches, for instance, traditional qualitative research or randomized controlled designs, things like that. We really focused on what has been proliferated, and that is just to say that not everything that is new and fancy is always better. But we certainly did want to map as the need to move forward in this research space and make good inferences, and therefore inform decisions around policies and programs. Next slide, please. So as Melissa and Ricardo and Felix have mentioned, there are some. They fit into some of the proliferation that we've seen, and the trends in terms of analysis methods or metrics for measuring diets have really come a long way. But today I'll just focus a bit on the gaps that we observed. I've mentioned a few of them, but on the type of innovation, the type of tool, metric, and method, we saw lots of, we didn't see that much around system level tools, metrics, or methods, or research design, as well as sort of dynamic surveillance or ongoing real-time research is picking up steam as we saw from Melissa, for instance, but hasn't come as far as it might have in this space. And then as well, I'll just mention co-production and participatory research was also not, we saw some of that, but not as much as in other areas. And then on these thematic domains, I won't go through this whole list, but just to mention that we didn't see that many research tools to look at power or conflict of interest or corporate engagement in the food, agriculture, nutrition, and health pathway or the food system. We also didn't see that many tools specifically developed for humanitarian contexts, emergencies, as well long-term vulnerability and fragile states. And then lastly, we saw some innovation around metrics and methods for gender, but other aspects of equity, such as occupation or caste or income, wealth disparities, and inequality were less addressed. So I will end end there. I know that's quite brief, and pass back to you, Ashari.
Thank you, Talia. I have a question, couple of questions coming in, but I think this one, I think it's something that we'd all want to hear. Are there any ethical or feasibility considerations to keep in mind while scaling data innovations that try to address its nutrition gaps?
Yes, I think I heard the full question. Yeah, so I'm not talking about a single innovation today. To me, the biggest challenge isn't necessarily dreaming up new innovations or getting them to actually function as they're supposed to, which is a no small task by any stretch. But the bigger challenge, I think, as Ricardo also echoed, is properly tailoring and implementing these innovations. So I'm specifically referring to issues such as privacy or dissemination of technology, and whether they are fit for the purpose of reducing exclusion and increasing access of those most marginalized. I think at times we do run the risk of a technocratic approach, thinking that innovation will automatically translate into solutions that benefit everybody. And this isn't always true. One example from our own work is that we're working with remote sensed data on flooding. I have a wonderful GIS specialist working with me, and we're trying to link the flooding to nutrition and mental health outcomes. And even in this particular analysis, we face challenges of capturing effectiveness. So not just how much water is on the ground, but really how that's affecting households differently in Bangladesh, and at the household level, but even more so at the individual level. And no matter how much we improve the parameters and the metrics of the GIS, we still face, we want to make sure that we're able to properly infer about unequal outcomes among individuals where some of the greatest disparities may exist. And so the community mapping approach is very exciting for Melissa, and we also, it's a wonderful start. And I think we also want to be thinking about how we can move even into individual level outcomes as those the drivers for communities may be even distinct from drivers for individuals. So I think in terms of, if we want to keep the focus on reducing inequity, innovation, I would say, should be used in the broadest sense. So not just for, I think a lot of us equate innovation with technology. And while there are many promising, wonderful technological innovations out there, it's more important that innovation overall is underwritten by processes and principles of things like human-centered design, co-production of research and development, the nutrition equity framework, and many others that put those who are meant to benefit at the center of problem solving and decision making, not just inclusion and asking their opinions afterwards, but really building that into the stream of development. And then just two last things for those who are doing for-profit innovations. I think we need to be especially careful about implications for equity and marginalization. And I think many companies are thinking about this, but it's just we do need to be careful because not everyone will be able to pay for the fancy data that we produce. And of course, it costs something to produce it, but just a consideration. And then lastly, in the end, I would just say that almost all innovations are impactful only when paired with creative and appropriate application, and frankly, good old-fashioned political will to roll them out and to monitor and to evaluate until we reach the outcomes that we intend to. So thank you very much.
Thank you, Talia. You mentioned political will, and that kind of reminds me. I think those Ricardo talked about, that being an enabler for the work that they're doing. And I just probably want to segue back to Ricardo, with a question that's related to something you've just said about privacy. Ricardo, TDH is collecting all this data, health data, that's very personalized information. What kind of procedures, policies, etc., are in place to protect patient privacy and confidentiality?
Thanks for the question, Mushiri. I think it's a fundamental point, and we do take seriously this point. I think it's a complex issue because from one side you want to exploit the data, but on the other side you must protect the data and in different terms. So our experience is that first of all, we are not using a TDH initiative. This is an initiative that we co-designed with the local authority, with the authority of Burkina Faso, and then with the one of Mali, Niger, Guinea, and India. So the owner of the data, or the person, the actor, the institute responsible for the data is the MOH. Our main goal is to strengthen the health system, and we do that through digital health. So the database is a Burkina Faso responsibility in terms of management and security, and we support that. We take responsibility to use that. At the moment, in the case of Burkina Faso, the database and the data management follows complies with the national law and the international law. It is temporarily stocked in a cloud hosted by US cloud, United States cloud, because it's managed by Dimagi, which is a software developer, and has developed a platform called CompCare, and we have been working with them for many years. Now, as part of our work with the Burkina Faso government, from the very beginning, because this was envisioned from the very beginning, we are transitioned to a Burkina Faso database where the government, the local government, will be the ultimate responsible for everything. And so, including access to data. The ultimate goal is really the authorities are in charge of that, and Terre Hommes itself will require special permissions and for specific usage the data sets. I hope this answers your question.
Right. Yeah. So at the macro level, the prevailing laws by your client, the government, give guidance in terms of policies, right? So, we get that, and I think one of the things when you mention governments, and you're working with governments very closely, Fraym is working with governments very closely as well. And I've a question here, which Melissa, especially because you're working with these LGAs in Nigeria and some of the other local and national governments around our regions. Someone's asking, how much do you know about how these data are used by governments or development actors to adjust or make decisions? And as you think about that, I just want to remind everyone that the chat is available, and you can ask your questions in the Q&A section. I've already seen some amazing questions there. Nico Keo, I can already see your issue of satellite images coming up quite a lot. So I think there are people here you want to cut immediately after this. So please let's make use of that for the Q&A. So Melissa, are governments using this data or development actors?
Absolutely. I mean, I would say our data sets specifically and most recently when it comes to the data we've produced in terms of COVID-19 response, resource allocation, and communication has been used by governments for in the early COVID days of thinking about crisis communications. So thinking about who is actually hearing messaging about prevention, and then about vaccines being available and where to get a dose has been used by specific governments and quantified the kind of universe of unreachable with key messages. Then we think about, from an equity lens, who is most in need of a vaccine dose, both from aligning with the kind of risk and vulnerabilities from an age and comorbidity, and then a socioeconomic lens, as to better understand kind of who is where, who meets this profile, and then how to best get the doses to those communities. And that work has been done in collaboration with institutions like the UNDP, who work directly with government to get this data into decision-making hands. So I think from a strategic planning and a resource allocation perspective, governments are using this data in two ways. One, on interactive platforms that, like Fraym that we looked at today, and two, through some of our reporting and analysis of the data to better understand the drivers. I think the last piece, and the closest touching to today's subject, is thinking about mapping different types of risk and vulnerabilities. So understanding who is, which communities are on the cusp of food insecurity, and using that for resource allocation and planning. We actually have a white paper on how that has been applied, how we've applied a food insecurity mapping framework to the data that we have, and then also how to use the data for decision making. So I think, all to say, there are a number of use cases, especially in response and especially when there's an acute need, like in the pandemic, for critical data to be integrated into systems. And we've seen this done also through some collaborations with partners like Grid3, who work directly with governments to integrate GIS and machine learning produced data into their decision making. And we've been doing that to map cholera risk and vulnerability and other health areas for a handful of countries now. So there's increased appetite and need and use. And my hope is that we start to integrate nutrition data in the same way with our partners, and then directly in relationship with government.
Thank you. And I hear, partnerships are a very core part of your approach, clearly in the different countries. Working with folks like Grid3 and the public sector, seems to take a very partnership-oriented approach.
In many cases, it's critical into integration with government.
Yeah, I mean, and so something hung here from a moment. Go ahead. Go on.
I was just saying that in many cases, the partnerships are critical to working with government when it comes to the type of data that we're producing.
Speaking,
Sorry, Ashari, I think your connection is breaking. Is it better now?
Felix, I should look like, in terms of, your scale, you're going to I don't know. Can you hear me?
Ashari, we can, yeah, I'm happy to jump in while you, you fix your audio. Just picking on Melissa's point around co-partners, Felix, one of the questions we got was, as you had mentioned, that, you are planning to scale across a few countries in the next few years. And so just envisioning, you moving forward, when you move into a new geography, who are some of the critical partners? How do you generate their buy-in? And just how does that scaling process work when you're starting afresh? Could you walk us through that, please?
Yeah, so we spent a lot of time basically researching countries to see, build out a scorecard and see who would be the best fit. And kind of one of the first decisions is, does that government support fortification? Has it mandated fortification of staple foods? And most East African countries thankfully have. And so what that enables us to do is, from day one, we don't have to spend a lot of time and resources to convince the government that this is a good intervention, or to do all that policy work and Gazette standards. That's already been done. So that really does ease the path for us into a new geography. So the government will remain a very strong partner. We sign MOUs, we make sure that we have all the approvals. We are part of their nutrition plan, right? And so we want to make sure that we're filling that gap. And we are filling a gap because there might be a mandate, a law passed in these countries, but it really only effectively covers these large industries because the government lacks the capacity to truly monitor the thousands of mills across these big regions. And so we take care of that, with our IoT and our dashboards. We're able to monitor these mills. I hope, we're in discussions one day to have, if these governments do have a database on fortification, that the large mills also adopt a more digitalized approach, and then combined with ours, the government will have access to in real time how much flour, fortified flour, or other industries as well, whether it's oil, salt, sugar, wheat flour for the large mills. So the government's a strong partner. We also look for implementing partners, whether that's a USAID Feed the Future program, or whether that's a TechnoServe. We do have a lot of overlap in some of their areas, whether they're working more with the farmers to improve inputs. We're working kind of in the middle of the value chain, and then other partners might work on, say, demand creation, advocacy, behavioral change. So collectively, we are part of an ecosystem to really get that job done, to get that flour fortified, quality fortified to people ultimately.
Great. And Felix, just quickly, 30 seconds on this, given that you mentioned government. A key problem we have in nutrition is the involvement, but also an opportunity, let me say, that you have many sectors involved. And so I'm assuming with fortification, when you're looking at nutrition outcomes, you'd be wanting to engage both the Ministry of Agriculture, but also the Ministry of Health. And so how do you bring the different ministries together, given that nutrition, touches on several areas? So just any experience on that?
Yeah, I think the key is to have a platform where all these ministries, including private sector, can meet. And so in a lot of these countries that have mandated fortification, there's what's called like the National Food Fortification Alliance. It might be called something different in each country, but these are either not existing or they're weak and not really developed. And so we want to really engage that platform. We're doing that in Tanzania, where all the ministries are represented, and private sector, large mills and us representing small mills can come talk about policy, talk about potential, say, exemptions on key inputs like nutrients, so that savings can be passed on to ultimately to the customer, which is the miller, to enable and to incentivize them. So that really is the best mechanism to have that open dialogue where private sector can completely communicate freely with these ministries, which are ultimately the decision makers.
Got it. Sounds good. Thanks so much, Felix. And last question on our Q&A for Thalia, especially given, you mentioned that there are several areas where, there are gaps. And I'm just curious, Thalia, if you had your wish list, which area, and I know it's a tough choice, but which gaps would you really want to prioritize? Would love to hear more on that.
Oh gosh, yes, there are many things to say, and hearing what other people have mentioned is exciting. I suppose this is very much my own thought, but I think to use and value more surveillance systems, quasi-experimental methods, and qualitative or experiential data is very important going forward. And I think these approaches don't always make it to the top of the data hierarchy, but they have important advantages over longer time frame studies and also iterative intervention approaches. So that's one. And then just a very specific interest, I think innovations around environmental and climatic factors affecting food production and nutrition will be very helpful and promising. So for instance, we make huge assumptions about nutrition based on food composition tables, which are wonderful, and they take a lot of work to compile, but they don't really provide a range of nutrients in the food because they don't include diversity, diverse metrics of soil and management practices, rainfall, climate, etc. So we can't really promote the best ways to improve nutrient contents of foods outside of biofortification, except in very niche environments and practices. So the work that you highlighted earlier that MAPS is doing is one interesting facet of this trend as well. Thank you.
Great. Thanks, Sally. Thanks for taking a step. I know it was, there are many areas, but appreciate you mentioning a few ones. So since we're near the time, maybe we'll give 30 seconds, a rapid fire for each of the panelists to give last thoughts. And I really mean 30 seconds. So maybe we'll start with Melissa.
Great, thank you. I think that my hope is that there is a lot of inspiring content here today, and that we can use some of the sub-national hyper-local data to really accelerate decision-making and advocate for the programming and for the needs that we all see on the ground, because data has the power to both shed some light on the issues, but then also move the needle on changing people's lives.
Great, thanks, Melissa. Next, Felix.
Yeah, this was really enjoyable for me to learn from the other panelists. I think there's a lot of collaboration just in this group, and as we expand to others as well. I mean, I think we're all working on the same thing and see better nutrition as a basic human right that unfortunately is deprived to many. So yeah, excited to take this offline and continue to work and yeah, really focus on East Africa.
Great, thanks, Felix. Next, Talia.
Yes, thanks. I would echo what Melissa and Felix said as well. It's been very interesting to hear what people are doing. And I would just say, you know, in driving these data innovations forward, matching them with getting the data into the right hands with enough push from the political side to push them really far forward, I hope we'll see impact from all these things going forward.
Great. And last but not least, Ricardo.
Yeah, thanks. It was very exciting to be in this webinar. I think we hear about the great potential of data. I think for me, the key message is first, let's get the digital transformation right, grounded in the field and considering all stakeholders, and then we can benefit from the wealth of data and transform data into valuable information for anybody. Thanks a lot.
Great. Thanks to all the panelists, but also to everyone who's joined this webinar. A recording of the webinar is now available on the Data for Nutrition YouTube channel, in case you would like to share with those who are unable to attend. And copies of presentations and summary of the Q&A, including the questions that were not answered, will be answered by the panelists and shared on the webinars group page in the next 2 weeks. We'd like to especially thank the hosts, the data community of practice, as well as the ANH Academy. And again, last note, the ANH Academy is happening soon, towards the end of June and July. And so if that is not on your calendars, please save that date. Thank you, everyone, and thanks again for joining us.